an update on something we talked about yesterday. The FDA approving the controversial little pink pill. Some calling it the female Viagra, made by Sprout Pharmaceuticals, known as flibanserin. It's going to be marketed, though, under the name Addie. Here's some information on the pill. Studies show it increased the number of satisfying sexual events by 0.5 to 1 additional event per month. Only trained physicians will be allowed to write prescriptions for this drug. And it will likely be covered by health insurance companies with a copay of $30 to $75. And Sprout says it should be available in October. Well, joining me now, Cindy Whitehead, co-founder and chief executive officer of Sprout Pharmaceuticals. Great to have you on The Real Story.
Thanks for having me.
So what is the real story about this drug? Who does it help?
The real story is that, first of all, this is a milestone moment for women. Women's most common sexual dysfunction. We've been waiting a long time to finally have a medical treatment option. Let's talk about who it will help. So this will help a woman with a medical condition called hypoactive sexual desire disorder, or HSDD. It's for premenopausal women. Let me describe a little bit about what HSDD is. It's women who've known a desire before that they were happy with. They've lost it. That's persisted for some time, and it's causing bother, either for them personally or in their relationships, and they want that back.
So it's not about performance, per se.
No, it is about desire. It's about women who've lost any sort of biologic drive, you know, the little things that remind us that we're sexual creatures, the spontaneous thoughts and fantasies, the willingness to initiate or even be receptive to advances.
Okay, so how will a person go about getting this drug?
So we will go forth with an educational initiative with healthcare providers and pharmacists, just to make sure that they become certified. They'll go through, understand our information, complete a knowledge assessment, and then women will speak with their healthcare providers about it if they think that this is right for them.
Okay, I want to take a look at some of the side effects, because we all know, we've seen commercials with the drugs, and at the end they're like, blah, 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 saying all the side effects, then you go, wow, look at all that. Okay, possible side effects: drowsiness, dizziness, fainting, which increases the risk of injuries such as concussions, extremely low blood pressure, less common. Also exacerbated these side effects when taking alcohol or contraceptives. What do you say to make women feel safe enough to take this?
Yeah, so we will have a label. So I'll tell you, we're very proud of the fact that we've studied flibanserin in over 11,000 women. So we've characterized those risks. We understand that our most common side effects are dizziness, nausea, and sleepiness. And then we look in challenge studies around interactions. So alcohol will be contraindicated to use with flibanserin. In terms of birth control pills, what we know is that birth control pills and Addie are metabolized the same way, so women might have more of those common side effects, but it doesn't diminish the effectiveness of their oral contraceptives, and they can be used together.
Okay, so some critics are saying that you only get modest results. For women, when they take this pill, will they just automatically suddenly feel like, wow, I want to go underneath the sheets?
I'll tell you, one, in terms of modest, I would say talk to a woman with HSDD and let her make the decision on what's meaningful to her in terms of improvements. We showed improvements in our clinical trials in women's desire, in their satisfying sexual events, and importantly, in decreasing their distress, which is why they're diagnosed with this condition in the first place. So, in terms of effectiveness, how long will it take to work? It takes some time. Addie works on the brain, and it's not going to work for all women. But if we look across our trials, we worked for the majority of women, and those improvements to them mean a lot.
Wow, it's very fascinating. Now women have the female version of Viagra coming in October. All right, Cindy, great to see you.
Thanks for having me.